My name is Trevor Dearing. I work for a company called Illumio, and I'm the global lead for healthcare solutions. I've worked in the cybersecurity industry now for just over 40 years, and through that I've worked in a whole range of different organizations, right from the invention of the personal computer through to networking, firewalls, and as the whole thing has developed through now to working with healthcare organizations around the world in looking at how they can deliver strategies like Zero Trust and build a more secure, resilient environment for themselves. I think one of the challenges that we face within cybersecurity for healthcare is really that I guess on the back of the pandemic there has been a huge investment in automation and technology to support practitioners and physicians, purely because there is such an overload and there's now a potential shortage. The challenge with that is it opens up the possibility for even more cyber attacks. So I think one of the key things that we have to make sure happens is that as we transform the whole digital process within healthcare, we have to transform the security at the same pace, or else we're creating the potential for disastrous cyber attacks that can lead to a cessation of services within hospitals and within other environments. So really the key thing is to make sure that we transform the security at the same way, at the same speed that we transform the whole digital infrastructure of healthcare. Yeah, I think what we see from regulators around the world is two things. So there's a level of enforcement that creates minimum standards for cybersecurity within any healthcare environment. But on the flip side, they also need to act as a guide, as a sort of a definer of the path to security. So it's no good just giving it the stick. You have to create the carrot. So I think one of the key things that regulators can do is to provide a guide to best practices. And we do see this within regulators and government agencies around the world. Increasingly, they're starting to talk about how to apply certain things, like maybe segmentation to the different pillars of diagnostics. So how you secure a genomics environment, how you secure scanning and imaging, how you secure maybe endoscopy and things like this. So I think being able to provide both that sort of regulation and a minimum set of standards, but also to be able to provide the guidance is really a key thing that regulators need to focus on, and also to make sure that it's applicable to all sizes of organisation and not just the highest end with the biggest budgets. Yeah, I think there's a real challenge that hospitals face, and that is that they obviously have a limited budget, and that budget has to cover investment in people, investment in medical technology, investment in IT, and cybersecurity. And it's often difficult to sort of say, well, okay, we're going to invest less in a certain medical technology rather than invest in cybersecurity. But the reality is that to maintain those services and maintain the ability to deliver those medical services requires that investment in cybersecurity. So to a certain extent, they need to be brave enough to take those decisions, and they need to be able to understand how that investment goes. And one of the key things is really to get back to basics, is to understand and develop a security strategy, just so that you're not just reacting to the next crisis by investing in the next sort of bit of shiny technology. So again, I think a combination of the regulator plus the hospital need to understand that things like Zero Trust, for instance, on the NIST cybersecurity framework, by building their strategy around that, they can actually do this and save money at the same time. And that obviously becomes really important because of the budget restrictions they face. So AI is one of those great things, and there's a lot of excitement about what AI can do within healthcare, around diagnostics, around understanding and collating information and being able to do all of that sort of thing. But the flip side of that is that cyber criminals and gangs are also using AI to improve the way that they attack. So we have to be cognizant that while AI is great in the healthcare environment, it's also great if you're a cyber criminal, and we have to sort of treat the two together. And I think, again, it comes back to doing the basics very well, because if you think about how AI will work and how the cyber criminals will use AI, they'll use it to learn where your weaknesses are. They'll use it to learn and try to understand exactly what your infrastructure is and where they can move and what they can do. So I think cyber cleanliness, so making sure that you're doing things like closing down any open ports and fixing any vulnerabilities, and those vulnerabilities you can't fix that you're mitigating for, is going to be key in combating any of those potential attackers that use AI within your environment. Yeah, so yes, there is a huge risk. The more we connect, the more susceptible we could be to an attack. I can remember having a discussion with a hospital where they were talking about the fact that during the pandemic, and they had lots of ventilators, and that they didn't connect the ventilators to the network. And so the physicians said to the IT people, why haven't we done that? And a lot of that was basically because of the risk of, as soon as you connect those systems in together, there's the potential for it to be exposed to the internet and various things. There's some research that I read recently that said something like 60% of all systems are insecurely connected to the internet that you have access to. So I think one of the key things is, the more we connect, the more we need to understand what can have access to that and what it's communicating with. So being able to map the connectivity of all of those connected systems becomes absolutely critical, and then being able to use that information to put in place all the policies you need to protect them. So we have to be careful with where we connect in those systems, what they're connected to, and whether they're exposed to the outside world. So there is huge benefits in having a lot of interconnected systems, but on the flip side, we do need to be careful about how we do that. One of the challenges that hospitals around the world face is budget and resource, and also the fact that what happens when something goes wrong. So when there is an attack, who do they inform, where do they get help from, and things like this. And no country's got this right. I mean, the reality is that there is a lot of challenges around that, because a lot of the time when if you're a hospital, especially if you're a small hospital, you're dealing with your own funding, you're dealing with your own sort of processes and things like that. So structurally, I think again, this comes back to the regulators to a certain extent. They need to be able to put in place a lot more support for individual hospitals, not only from a concept of what to do when something goes wrong, but also how to deliver more reliable security and resilience within that environment. And to a certain extent, some of that may involve some funding, may involve the way that things are funded. It may involve change to the regulation to almost force a certain level of investment of revenue within those things. Because if you are a CISO in a hospital, you are you are reacting and all the time to the circumstances of that hospital, how much money it's making, how much revenue it's generating. So I think there has to be some sort of shift in that to raise the profile of that sort of potential cyber attack, because the reality is, and luckily we haven't seen this yet, but if there is a major attack that is focused specifically at healthcare that stops the delivery of services, there is a real problem, and suddenly everyone asks questions after the effect. So there has to be a major drive, whether that's federally, whether that's state-based, whether it's regulator-based, to make sure that there is an increased focus on cybersecurity. As the thing that we say across all government is that cybersecurity doesn't win votes. So that provides a real challenge to where that investment is made. So there's a lot of restrictions in healthcare that don't necessarily fit within other sectors. So if we take the energy sector, for instance, and we look at, say, the electricity network, then there is the capability to build security within that environment. And one of the challenges with healthcare, quite rightly, is that all systems need to be certified and they need to meet a certain standard of security and things like this. But by doing that, it doesn't make it easy to then mitigate potential vulnerabilities within those systems. So I think there needs to be a sort of a slight rethink in this. And if we look at some of those other examples where organisations are able, in a certain amount of way, under a certain level of restrictions, be able to deploy cybersecurity technology into those say transformers and substations and things like this, we need to, in healthcare, look at a similar sort of thing. So yes, you can't touch an X-ray machine, but you probably should be able to install cybersecurity technology onto the controllers and the systems that are connected to that. So I think there needs to be a bit of a rethink, because technology is sort of outpacing the existing way that we do things. If we sort of compare the way that cybersecurity in healthcare is delivered in the US and in other countries, it varies wildly. So in very sort of structured environments, so within the UK, for instance, where there is a single national health system, the central body of the national health system have sort of defined the way that a lot of things will happen, and they've done things like invest in centralized security licenses to sort of take some of the burden off of the individual hospitals. When you get to countries like Korea and Japan, again, the way they're funded is different, and so that they're a lot highly funded because the tax system is able to be able to do that. So when you look at hospitals here, because of the sort of the structure and the way that they're pretty much all privately funded through insurance and things like that, it is a balance between the revenue and the expenditure to sort of be able to do that, and that can have some challenges, especially in smaller healthcare environments. So I'd say that there's good and bad. So at some points, within sort of the larger hospital groups, you get very, very strong cyber security, but there is the risk in some of the smaller ones that with the level of funding and resources, it's quite difficult for them to sort of meet those same levels. So again, it's something that needs looking at potentially to sort of make it easier for those organisations to be able to deliver that same level of security.